Pharmacology, Cardiovascular, Antilipemics. And antilipemic agents reduce hyperlipidemia that may lead to additional health problems such as stroke, myocardial infarction, angina, and heart failure. Medications should be used in adjunct with a healthy diet and exercise regime approved by the patient's healthcare provider. Atorvastatin, the mechanism of action. Atorvastatin inhibits HMG-CoA reductase and cholesterol synthesis, which reduces LDL or low-density lipoprotein. Indications. This medication is used for hyperlipidemia and the prevention of cardiovascular disease. Considerations. Do not use with patients who have hepatic disease. This medication is contraindicated with patients who are pregnant or breastfeeding. Do not give to patients under 10 years of age. Use caution with geriatric patients due to increased risk for myopathy. Adverse effects. Patients who are pregnant or breastfeeding should not take this medication. A healthcare provider will assess routine liver function for a patient taking atorvastatin. Nausea, diarrhea, dyspepsia, increase in blood glucose, rhabdomyolysis, myalgia, or muscle spasms may be produced by taking this medication. Rhabdomyolysis is a condition in which damaged skeletal muscle breaks down rapidly, causing muscle pain and weakness. Some of the muscle breakdown products are harmful to the kidneys and can cause kidney failure. There may be tea-colored urine and an irregular heartbeat with rhabdomyolysis. Patient education. Patients should take the prescribed medication as directed and avoid consuming grapefruit juice during drug therapy. The medication should be used with dietary modifications. If the patient experiences muscle pain, tenderness, or weakness, these should be reported to the healthcare provider. Ezetimibe, mechanism of action. Ezetimibe blocks the absorption of cholesterol in the small intestines to reduce LDL. Indication. This medication is used for treatment of hyperlipidemia and familiar hypercholesterolemia. Considerations. If medication is combined with HMG-CoA reductase inhibitors, do not give to pregnant or breastfeeding patients. Adverse side effects. Use with caution when ezetimibe is combined with additional medications. Patients may experience arthralgia, rhabdomyolysis, hepatic impairment, dizziness, upper respiratory infections, or diarrhea if they are taking this medication. Minimal side effects were reported with monotherapy. Patient education. Patients should take the prescribed medication as directed and avoid consuming grapefruit juice during drug therapy. The medication should be used with dietary modification. If the patient experiences muscle pain, tenderness, or weakness, this should be reported to the healthcare provider. Cardiovascular pharmacology, blood coagulation modifiers. This section we will discuss medications that affect blood coagulation and includes several types of medications including anticoagulants, antiplatelets, and thrombolytics, as well as their associated reversal agents. Anticoagulants prevent the formation of a clot by inhibiting certain types of clotting factors. Anticoagulants include the following drug classes: heparins or unfractionated heparin and low molecular weight heparin, warfarin, Coumadin, selective factor XA inhibitors such as rivaroxaban, and direct thrombin inhibitors such as dabigatran. Antiplatelets include aspirin and other aggregation inhibitors such as clopidogrel, and thrombolytics include alteplase or TPA. All these types of medications are included on the list of high alert medications by the Institute for Safe Medication Practices and require special safeguards to reduce the risk of errors or adverse effects. The most common anticoagulant errors in acute hospital settings are administration mistakes, including incorrect dosage calculation and infusion rates. The Health Research and Educational Trust focus on reducing harm related to HAMs by 50% and recommends the following interventions to achieve this goal. Educate staff based on evidence and best practices. Use standardized order sets and protocols. Perform medication reconciliation at all transition. Specific interventions regarding anticoagulant therapy include standardization of protocols for withholding and restarting warfarin perioperatively, including pharmacists on rounds to provide decision support for staff administering HAMs and to reduce prescription errors, pharmacist monitoring of anticoagulants, and pharmacist notification when rescue medications are given. According to the Institute for Safe Medication Practices 2016 annual report, there is also a high risk of acute injuries for patients taking anticoagulants outside of the hospital setting. Anticoagulants are commonly used by the elderly to reduce the risk of ischemic stroke, with an estimated 3.8 million people taking oral anticoagulants in 2016. Data show that adverse effects of oral anticoagulants accounts for more emergency department visits than any other class of drugs. Adverse effects range from gastrointestinal bleeding to cerebral hemorrhages, resulting in over 3,000 deaths. Since 1954, warfarin has been standard but hazardous treatment for preventing blood clots. Warfarin requires close laboratory monitoring and individual dose adjustments based on PT and INR lab results. When the pharmaceutical industry began marketing modern replacements for warfarin, including dabigatran, rivaroxaban, and apixaban, they designed them to be easier to use than warfarin because no laboratory monitoring was required, but not necessarily safer. It is vital for medics to provide thorough patient and caregiver education for patients prescribed anticoagulants at home. Suggested patient education topics are included for each type of medication below. Heparin sodium. Heparin sodium is an anticoagulant that can be injected or used intravenously and is formulated in several dosages. Due to heparin being a high alert medication, hospitals use several processes for storing and labeling the medication to help prevent errors. It is also important to note that there is a type of heparin flush, often referred to as Heplock, that is used to maintain the patency of central lines. The dosage of heparin in heparin IV flushes is much different than the heparin dose used as an intravenous medication to prevent or treat a blood clot. Most hospitals have weight-based protocols for IV heparin administration that titrate a patient's dosage to be within a therapeutic range based on the results of a lab test called partial thromboblastid time, or PTT. PTT is a blood test that looks at how long it takes for a blood to clot. Patients receiving heparin subcutaneous injections to prevent DVTs, or deep vein thrombosis, do not require PTT monitoring. Heparin comes in many dosages and overdose can be deadly, so it is important for the medic to use safeguards to prevent potential medication errors. The mechanism of action. Heparin inhibits the activated coagulation factors involved in the clotting sequence. particularly 10A and 2A. Heparin also prevents the formation of a stable fibrin clot by inhibiting the activation of the fibrin stabilizing factor. Heparin does not have fibrinolytic activity, therefore it will not break down existing clots. Indications. IV heparin is commonly indicated for the treatment of deep vein thrombosis or thromboembolism, DVT, or pulmonary embolism. It is also indicated for use during an acute myocardial infarction. Subcutaneous heparin is commonly indicated to prevent DVT or embolization caused by atrial fibrillation. Heparin IV flushes or HepLocks are used to maintain the patency of central IV lines. Consideration. When bleeding requires the reversal of heparinization, protamine sulfate by slow infusion will neutralize heparin sulfate. A higher incidence of bleeding has been reported in patients over 60 years of age, especially women. Fatal hemorrhages have occurred due to medication errors. Carefully examine all heparin products to confirm the correct dose. Prior to the administration of the drug, IV heparin therapy requires close monitoring of frequent partial thromboplastin time or PTT results to ensure dosage as in therapeutic range and to reduce the risk of overdose with associated bleeding. Dosage is considered adequate when the activated partial thromboplastic time or APTT is 1.5 to 2 times the normal, or when the whole blood clotting time is elevated approximately 2.5 to 3 times the control value. This drug is contraindicated in patients with a history of heparin-induced thrombocytopenia, HIT, and heparin-induced thrombocytopenia and thrombosis. HIT. HIT is a condition where platelets drop 30% or more below a patient's baseline after heparin is administered and can lead to HIT where thrombi are formed. Use with caution with medication that affects the coagulation cascade due to additive effects that increase the risk of bleeding. When a patient is receiving IV heparin therapy to treat a blood clot, and may be overlapped with oral warfarin to establish anticoagulation therapy after discharge.